So here's another example of why the angle of your catheter dwell matters. How many of you would have just sat there and waited for the blood to draw when it stopped? Because I had the ultrasound, I can change the angle of the catheter and now get full draw of the blood right there. Did you see what happened to the vein? You don't like suctioning, do you? No airways for you. I like it. I like it. So that vein was collapsing. We're going to go deeper into that with the aspiration piece. That's a butterfly needle. What just happened? It went out. The vein collapsed.
Yeah.
Okay? Watch it again. It collapsed. What's happening here? This is the part that we're not realizing until you look at it with ultrasound too. And then when I let go of the vacutainer, so what's happening is the vein has a certain amount of blood, and when we drop too much, it closes that vein. And we hold that pressure. And when I say about holding pressure, causes hemolysis. And so what we need to do is give it time for blood to fill back up to that point. So what do? Pull, pause, pull, pause. If we hold pressure, we're going to hold that vein closed and no blood's going to get into it because we're forcefully keeping that closed. So that pull pause technique, that's why. So if you ever see it stopping, just take off that vacutainer, use a syringe and manually control that flow.